In previous video, we talked about the checkup and diagnosis portion. In today's video, we are going to talk about the restorative treatment. Now, what is the restorative treatment? Mainly in restorative treatment comes the filling and the root canal included. In today's video, we are going to talk about how it is performed in the adults and the kids. Hello everyone, this is Dr. Swapnil Chandratre here. This video is the second portion and the second part of Let's Learn Dentistry. As I have discussed before, we are going to talk today about the restorative treatment for the dentistry here in Germany. As I mentioned in the previous video, if you haven't checked out about the checkup video, you please check it out. In that video, I have mentioned a brief about the insurance system, that how the patient checkup is done. Okay, now so after a new patient checkup or a regular checkup, once it is been diagnosed, insurance, the filling treatment is included in that. Okay, but in insurance you have to understand they have budget for each and every type of the filling. Now filling treatment is dependent upon how much surface of the teeth is covered. Okay, so for example, 1 surface filling, 2 surface filling, 3 surface filling, or complete tooth restoration. These are the different surfaces of the tooth. Okay, and based on that, for each and every filling, okay, the cost has been included in that. With that, with some additional thing that you can always add in that thing. For example, when you give injection for the filling, if you add a rubber dam with it, or you use some another technique for the separation, if you do indirect pulp capping, those all are the things that are the separate thing that you can get money from insurance, and over that you do the filling treatment. This filling treatment, the cost what includes here, that is generally considered as very low for the German standard. Of course, in Indian standard it's too much money, but for here standard it is little bit low. What was happening till now was that in so many clinics, for insurance it is very important, they don't care that which filling material you use for the posterior teeth. Yeah, of course, for the anterior teeth they want you to use the only composite resin, okay, because it's a aesthetic region. But for the posterior tooth, any type of cavity, class 1, class 2, class 3, or whatever it is there, in that scenario you are allowed to choose your material of choice. Okay, but the important criteria for them is that this material should last minimum 2 years. Okay, so you cannot ask for the money in within 2 years time. For example, if you have done one filling in lower right first molar, after doing that filling on some date, okay, from that date till 2 years of the time, you cannot ask for the insurance for the extra money. Okay, so if in between this time whatever the problem happens with the tooth, okay, generally you are liable to replace this filling. Okay, if that filling comes out or if that filling is broken, then you are liable to replace it free of cost. For them it is they don't care what you use for the posterior teeth. Okay, so with this guarantee thing for the 2 years time, generally comes only 2 good material which can be you can use it for a longer run. Okay, one is this old amalgam filling, or the second is a composite resin. Till last year the amalgam filling was included in this insurance. Okay, it was allowed to do the amalgam filling. So many clinics were using amalgam filling because amalgam filling is cheaper. You don't require too much of dryness to do that thing, and you can use it in every place and all that thing. Okay, and it is very fast to do. Okay, so previously clinic owners were using amalgam filling as insurance filling. Okay, for those people who cannot pay extra for the filling, in those filling cases they were using amalgam filling. But from 2025 the amalgam is entirely forbidden in this entire EU region. Because of that, you are not allowed to do now the amalgam fillings here. What it leads to was that additional different types of filling options. Clinicians are now using bulk fill or this cheaper type of composite filling what they are doing, and that is now the option of insurance thing. There is also one provision here that insurance are saying that this is the money we are going to pay for the filling. Over that you can charge also extra money. This extra money, whatever you are charging, it should be justifiable. Okay, so you just cannot say that okay, give me 100 euros and we'll do that. Okay, it is not like that. Okay, you need to have a perfect position and you need to justify each and every penny here. Of course, there are many positions and all those things which you will later on learn when you working in the clinic. Most of the clinics are, more than 90% of the clinic are charging you extra for the composite filling. These charges are depending upon that type of clinics and which area you are living, what kind of filling they are doing. They are charging you from the range of 50 euro to 500 euro also. This kind of liberty is allowed because it is a skill dependent thing. When we see some composite filling, some practitioners can do a very good fillings, okay, and some can do a very bad filling, and if they both are paid equally, then there is difference in type of the quality. Okay, so to differentiate this thing, insurance companies have allowed you to take the additional money based on whatever you are bringing to the treatment. Based on that, you can charge. There is an extra insurance which is called as a Zusatzversicherung. Okay, so this Zusatzversicherung, that means an extra insurance. This insurance mostly cover the additional cost for whatever happening for this high quality treatments. Okay, and you need to pay extra in a monthly base. Okay, that in range of 10 euro to 50 euro per month. With that, so many additional treatment, whatever the paid treatments are there, so much additional cost has been covered with that. If you are planning to live here in a longer duration, it is advisable for you and your family to have this Zusatzversicherung. That is all about the filling in adults. In terms of filling in kids, the same thing is there with the adults than compared to the kids. Only difference in the kids and adults is that previously in kids with the milk tooth, the kids below 13 years of age, those were good and highly paid fillings compared to what the adults were. Okay, but from this year onwards, the insurance system has thus removed that additional benefit, and now it is been paid same as kids are paid same as the adult. The only difference is that when you do that composite filling in any milk tooth, okay, in that scenario you are not liable for a guarantee. Okay, of course you can repeat it once or twice. It's not like that you can repeat it 20 times, but you are allowed to repeat that filling once or twice in 2 years. There is not a huge guarantee stress is there because milk on the milk tooth, this composite filling doesn't bond very good. That's why this kind of liberty has been given. But for the permanent tooth, that remains the same in terms of adults and the kids. This is all about the fillings in adults and kids. Now coming to the second portion of the restorative treatment is the root canal treatment. Now root canal treatment is always a debatable thing in terms of guarantee, okay, because we all know that the root canal treatments are unpredictable. Okay, even though you do a very good root canal treatment, still it can fail, or you do bad root canal and it can last for years. It's very unpredictable, but still insurance company have one standard protocol that you are liable to take a pre and post operative X-rays. In your post-operative X-rays, your gutta percha file, it should be up to the apex or 1 millimeter from the apex. Okay, so that is the condition for a successful root canal treatment. If any problem happens to the patient and if the patient complains, then you are liable to repeat that root canal treatment free of cost. Ideally, that is also in a 2 to 3 years of the guarantee phase. As I say, the guarantee is always debatable in terms of root canal treatment. It is also like that. In root canal treatment, the insurance have also the budget. Okay, they will pay some X amount of money for a single canal tooth, for a 2 canal, for 3 canal, for 4 canal. So every more the canals are there, the more the money you get. They have the fixed budget for it. It doesn't matter if you use a hand file, if you use a rotary file, if you use a warm compaction obturation, or you do a single coat, or you do a 2% normal thing, or lateral condensation. It doesn't matter. Their criteria is that gutta percha should reach till the apex or 1 millimeter near to the apex. Technique doesn't matter. Okay, you have to just perform like that. For your skill, you are again allowed to charge extra. Of course, in that extra charge, you cannot justify that you have used this kind of file or something like that. Okay, for that idea, you are not allowed to charge more. Okay, but you can the clinics are charging for another things like if you are using rubber dams or all the chemicals what we use for the root canal treatment, the fillings what we are doing above it, and all that thing you can charge extra if you are using a microscope, if you are getting done from the specialist and all that thing. So then you can charge based on that on clinic to clinic basis. Okay, it can range you from 50 euro to 2000 euro also. Again, here comes the Zusatzversicherung into play. Okay, so most of the Zusatzversicherung covers this root canal cost, whatever you are going to pay extra. You are able to get very high quality treatment also included in that thing. Otherwise, you have to pay it on your own. In terms of restorative treatment, this is the criteria what the insurance is following. This is the way the patients are handled for the restorative treatment. I hope that I have given you enough information or a rough information that how these things work box. If you like the contents and this kind of things, if you want more, then please write in the comment. Okay, please like, share and subscribe so I will have motivation to make such videos. Till then, have a nice day.